Everybody, I am Dr. Kefari, pharmacist and pharmacologist, and would like to speak about pharmacological drugs. And I chose Lippincott drug list, and I would like to speak about that. The first group of drug which I would like to speak about is a drug affecting the autonomic nervous system. As you know, in the body we have a peripheral nervous system in two groups. The one of the groups is the afferent, which it is a sensory, and the other one is the efferent nerves. Efferent nerves can be in the motor neuron and the autonomic nervous system. In the autonomic nervous system, we have a parasympathetic and sympathetic. Okay, which parasympathetic belongs to the cholinergic, and sympathetic belongs to the adrenergic. The first drug which acts as a direct acting, and we can use it as a medicine. The first drug is acetylcholine. Acetylcholine is a neurotransmitter in the body, which we can find in the preganglionic nerves, in the autonomic nervous system, and the postganglionic nerve of the parasympathetic nervous system. And also we can find this neurotransmitter in the neuromuscular junction. Acetylcholine also can use as a medicine, as a drugs. Usually this medicine with the brand name of the Miochol-E, okay, it can use for the intraocular, okay, and mainly we can use is the meiosis during ocular surgery, and it can use also in the cataract surgery of the eyes. These drugs also can have some side effects. For example, can cause a corneal swelling and cause a corneal clouding, and also sometimes it can affect the inflammation of the cornea. But because it's used locally, usually it's not possible to have a systematic side effects, but usually acetylcholine can cause lower blood pressure if it goes in the systematic nervous system. Also, it can cause slow the heart rate. And the main things about these drugs can interact with some of the drugs, some eye drops in the surgery, and usually surgeon knows about this and usually not recommend about these drugs. And also these drugs is because it is a quaternary amine, it is very unstable, and mainly these drugs just use as a powder form, because in the powder form it is very stable, and before using, for example, before surgery, they can use with liquid for the dissolve it, and it can use for the meiosis purpose. The second drug, which is important for us also, the name of the drug is the Bethanechol, or we can say the brand name is the Urecholine. Okay. Also, we have other brand name is the Davoid. These drugs can be used as a oral tablet, and also can use as the oral tablet, and with the different doses, usually 15 milligram and 5 milligram, and also in higher dose after 25 milligram. And this drug can be also is used before to treat urinary retention. Usually after surgery, this problem can be happening in the patient or in the delivering of baby. But now mainly they don't use about this drug. And but it is one of the drugs can cause direct parasympathetic, and before taking this medicine, we have to speak about the condition of the patient, about it if he has the asthma or epilepsy, and is patient can use this drug or no. And mainly this drug is one of the strong direct parasympathetic, which is important in the pharmacology. The other drug, it is very important. It is a Carbachol. Carbachol, which we can say with the brand name, we can has several type of the brand name, and the brand we can, for example, Miostat and isopto Carbachol. This drug is a direct acting miotic agent, and usually like acetylcholine can use in the ophthalmology, and this drug also can use in the ophthalmology. And this drug usually used for induced meiosis before or during the surgery. And also we have a other brand name. I think the name is the Carpstat. This drug can be directly bind to the cholinergic receptors, and also it can use in the during or after the cataract surgery. And this drugs pharmacologically, as I said for you, it is a parasympathetic, and it is as a agonist for the muscarinic and nicotinic receptor. Okay, and before use of these drugs, we have to ask about the condition of the patient, like for example, risk of acute cardiac failure or asthma, or also GI tract spasm or urinary tract obstruction. And sometimes also it's very important in the patient with a Parkinson problem, because in some case in the pre-Parkinsonic patient, we have to care about these drugs. And these drugs usually absorb very poorly in the GI, and normally we use in the eye surgery, and also the metabolism of these drugs can be carbomyocholine, and these drugs can be eliminate body degradation, and it is one of the important drugs, and usually like other direct cholinergic agonists in the overdose can be cause very big problems. And as you see from these three drugs, mainly I spoke about the eye surgery and cataract. It is mainly used because the side effect of these drugs can be so important, and for systematic use mainly we don't use from these drugs. The next drug is the name is the Ceimeline, and the brand name is the Evoxac. Is a direct muscarinic agonist, and it is used for the symptomatic treatment of the dry mouth in the patient with Salagen syndrome. And it affects usually for the muscarinic receptor like M1 to M3, and it is indicated by the Pharmacological International Conference as the one of the best treatment for the dry mouth in the Salagen syndrome. From structurally, it has a cyclic form, and usually these drugs can bind to the muscarinic receptor in the mouth, and cause increases secretion of the salivary gland, and these drugs metabolize in the liver with usually with the enzyme CYP3A4. Okay, and also half-life of the drug is moderate or around 6 hours, and mainly the drugs used in the low dose, and usually it is in the tablet form. And the next drugs is the nicotine. As you know, the nicotine is one of the neurotransmitter. Also, it can bind to the nicotinic receptor. And these drugs we can find in the cigarette and the smoke materials. It is a stimulatory alkaloid. You can find, for example, you can find in the cigarette or other tobacco. And mainly nicotine in the pharmacy used for the relief of the nicotine withdrawal syndrome after when the patient want cessation of the smoking. And the nicotine in the high dose is very toxic alkaloids. As you know from the structure, it has a pyridine and the M-methyl pyrrolidine ring, and it is small molecules. Usually, as I said for you, for the help for the patient which want cessation of the smoking, and the absorption is high for these drugs, and also direct agonist for the nicotinic receptor. Okay, as I mentioned, these drugs can also absorb from the buccal mucosa in the mouth. Also, the absorption is high, also in the mouth. And usually we can use as a patch or chewing gum, and also for the chewing tablet. And usually some part of the drugs eliminated by the urine without change unchanged form, and the half-life of this nicotine is very high, usually around 20 hours. And in the high dose, it can be toxic and can cause vision and confusing problem. Also, it can affect in the respiration and also hypotension. And as you see, I mentioned all of these drugs. As you see in the first groups, we use for the eye surgery, and then we use the dry mouth, and the last drugs we use the for the withdrawing of the smoking in the patient. And the last drug of this group, which is very important also in the medicine, this is a Pilocarpine. The Pilocarpine, the best, I know the brand names, which is important. It is a Bethanechol, and also we have a Salagen. Usually this drug is very important, and it is a muscarinic cholinergic agonist, and which used for in the eye for the usually for use ophthalmology in the eye to treat elevation of intraocular pressure. Mainly we can use in the when the intraocular pressure is high, for example in the glaucoma, and also the induced miosis. This drug also can be used for treatment of the dry mouth, which is associated with the Salagen syndrome. Also, sometimes it's important, I forgot before, in the radiotherapy of the neck and the face because of the cancer or tumor. After that, because of the radiotherapy, we can prescribe for the patient's drugs. These drugs is slowly hydrolyzed, okay, and mainly we can use in the eye drops for the treatment of the glaucoma and to decrease intraocular pressure. And also, as you know, it is pilocarpine is a cholinic ester form, and as you know, acetylcholine has a quaternary amine structure, and in the structure of the pilocarpine, we can see imidazole, which bind to the tetrahydrofuran ring, which has the bind to the ketone group, and also it has the chirality. It has the two chiral center, which is important, and usually the absorption dose is low, and also these drugs has a very low half-life, and it is very unstable. Then in the first lecture, mainly I spoke about direct acting drugs which affect in the cholinergic receptors as a cholinergic agonist. And this drug is one of the important drugs in the treatment of the autonomic nervous system. Okay, in the summary, I can mention these drugs can be used for in the ophthalmologic and in the dry mouth, and the withdrawal of the nicotine, withdrawal of the smoke, and also can be used for the decreasing intraocular pressure. I hope this lecture will be good. I will try to speak about the next part, mainly about the other drugs, and also continue this drug list and the classification and about side effects. This group which I mentioned, direct acting, usually we don't use as a systematic treatment, and but it can affect, if it reach the systematic circulation, it can cause as a parasympathetic effect. It can decrease heart rate, increase the secretion of the GI tract, can cause sweating, and also can affect in the respiration, and also some of the drugs can affect in the CNS, also can cause dizziness or nausea and some other side effects, which is important. And I hope it will be good, and I hope see you again in the next lecture. Have a good time, and bye.